enforces these federal laws that apply to those entities as a result.
And can you tell us about what Title VI requires?
Sure. Title VI of the Civil Rights Act of 1964 is the oldest of the laws that we enforce. This law prohibits discrimination on the basis of race, color, or national origin. Now, one form of discrimination is a failure to provide language services for persons who are limited English proficient. Now, this can be considered national origin discrimination because a person's primary language is typically related to their ethnicity. So, under the law, healthcare providers must take reasonable steps to provide meaningful access for limited English proficient persons. Now, what that means in practical terms depends on a number of factors. We've taken much of the mystery out of this by publishing guidance in 2003 for the recipients of our federal funding. Our HHS guidance explains 4 factors that healthcare organizations can use to determine what steps would be reasonable for them in providing language interpreters and in translating documents for persons who are limited English proficient. Now, the 4-factor analysis suggests considering the number or proportion of limited English proficient persons eligible to be served or likely to be served by that program or service, the frequency of contact, the nature and importance of the program or service being provided, and lastly, the costs and resources available. So in a large hospital setting, of course, the importance of the service, health care, sometimes urgent health care, is surely going to be great. And typically, too, in a large hospital setting, costs would not be seen as overly burdensome in relation to resources. The number of LEP persons and the frequency of contact with these persons could be important factors, though especially with respect to the type of interpreting service that might be considered sufficient. For example, staff interpreters or a language line or both. So if you have a high concentration of limited English proficient persons that you're seeing regularly, then staff interpreters would certainly appear to be a more reasonable approach to providing language services.
And what about the laws that apply to deaf and hard of hearing persons?
Section 504 of the Rehabilitation Act and the Americans with Disabilities Act. Now, both of these laws work together to ensure that healthcare providers provide effective communication with individuals who are deaf or hard of hearing, so long as it does not fundamentally alter that program or service or result in an undue financial burden. For persons who are deaf and hard of hearing, effective communication means that persons with disabilities have communication that is as effective as communication with others. Simply put, you have to provide communication to the deaf and hard of hearing, the same communication that a person who is a hearing person would have the benefit of. The Department of Justice has published an excellent business brief that sets out the important situations where sign language interpreters are likely to be necessary for the deaf or hard of hearing. These services include discussing symptoms with the patient, diagnosis, medical tests, prognosis, treatment options or discharge instructions, obtaining informed consent, providing information on physicians' rounds, providing mental health services, and certainly when discussing complex billing or insurance information. So we want to stress that healthcare providers need to know that their obligations under these important laws protecting persons with disabilities, including those who are deaf or hard of hearing.
And Amy, can you tell us about relevant Joint Commission standards?
Sure. Tamara's comments really provide a nice segue to talk about the Joint Commission standards in this area. The Joint Commission standards related to effective communication really start in our standards that address patient rights. We have standards that talk about the patient's right to effective communication, and that includes their right to having interpretation services and translation services provided as necessary. Those standards also speak to the need to have appropriate written material provided to patients in a manner which they understand. But as we've looked at these issues and studied them, we realize that this really isn't just about a patient's right to these services, because as much as the patient has the right to effective communication, providers also need effective communication with their patients in order to do their jobs. And that's where we see this transcend into our standards that relate to actual care practices. Tamara mentioned many of the points of care in which effective communication is quite necessary. She gave some specific examples. And it's interesting to note that we have standards that address many of those points of care. For example, we have a standard that talks about the need for informed consent and the process of informed consent. I think it's important to note that when we think about informed consent, it's not just the written document either, that it's that process of having a dialogue. And how do you do that without effective communication and having someone who can interpret there if a person doesn't speak English or is deaf or hard of hearing? Also, we have standards that address other points of care such as patient education and the need to have patient education provided to the patient and the family in a manner in which that patient and family are going to understand. And this isn't really something that should be seen as burdensome, but instead something that's going to support the actual care process, both for the patient as well as for the care provider. So I think if we look at this, we're beginning to look at this as a much broader issue than just something that we do to support a patient's right. While it is their right to have effective communication, it really is incumbent upon us as healthcare providers to embrace this and work as we can to make sure that communication is effective for all patients.
And what might surveyors look for to determine compliance with these standards?